Welcome back, everybody, to this week's episode of Spartan Pulse. We really hope you guys have been enjoying our weekly episodes and enjoying this beautiful weather. I'm Taylor Myers.
And I'm Terrence Lansey. And thank you for joining us today. Today we're going to talk about the Nurse Anesthesia program here at Michigan State University in the College of Nursing. Joining us today, we have current Nurse Anesthesia students, Raneen and Michelle. And thank you all for coming today.
Hi. Hi there.
So why don't you guys just give us a little bit about yourselves and what you did prior to coming to the program and where you're at in the program.
Okay, I'll start. My name is Michelle. I was an ICU nurse at Detroit Receiving Hospital in downtown Detroit for 3.5 years. We do have to be ICU nurses before we can even apply to the program. We are finishing up our first year of the Doctor of Nursing Practice Anesthesia program. It is a graduate program. It's a doctorate.
Yeah. And my name is Raneen. Thank you for having me today. I have also worked in the ICU. I worked at Royal Oak Beaumont Hospital in the Metro Detroit area. I've worked there for almost 6 years. 3 years of them were just patient care and being a tech. I worked in a neurotrauma ICU, and like Michelle said, before we apply, you just have to have a variety of experience in the ICU. And we are finishing our first year, and this is our third semester, and we start clinicals next semester.
That's awesome, guys. So I kind of feel like there's a lot of misunderstanding about what exactly nurse anesthesia is. So could you kind of just give like a brief description of like what a nurse, like what you would do with that position?
Sure. Yes. So to start off, in order to be a nurse anesthesia, like we said, you have to have your BSN, which is your nursing degree. It's kind of different than ADN. You need to have your bachelor's, you need to have your ICU experience. So you are pretty much working in the OR. You are putting your patient who are going under general anesthesia for any surgery. There's different types of anesthesia. There's you going under complete general anesthesia being tubed. There is max sedation, which you can be awake and still have a surgery. There's regionals, which have many different subcategories as well. It's kind of putting our patient down for a surgery, but monitoring so many other things. We have to make sure that their pain is controlled, their heart rate and blood pressure is controlled, everything looks good, and we have to make sure that they wake up safely the end of the surgery.
Yep. So it's basically when you go to sleep during surgery.
Yep.
And another thing that people may be familiar with that we do are epidurals, in our pregnant moms. That's something that is commonly known.
Yes, very intense workload. Very intense, putting people on incubating patients and making sure you have pre-op checkoffs and things like that is very intense. So I really appreciate it. I want to know, how do you guys balance school and figuring out as new anesthesia students, how do you all like balance like all the workload, all the new classes, the new introduced anesthesia is different from being a regular nurse, or it's a whole new ball game. So how do you guys deal with that or control?
Yeah, so well, the biggest difference I would say is graduate nursing learning. So it's a lot of material, lots of slides to go over, lots of detailed, important information that we have to not only remember for the exam, but we have to apply long-term. So that's a difference for me anyway. With my other degrees, it was sort of, well, if you don't retain this later, maybe it's not a big deal, but now it's all things that we need to know. So it's more re-studying things over and over again to obtain that long-term memory of material.
That sounds like a lot. What advice do you guys have for anyone who's maybe like in nursing right now or in nursing school right now and considering going back for nurse anesthesia?
One of the biggest things for me that I realized is some of these schools actually do require you to shadow at least one day in the operating room for 8 hours or 4 hours. However, I recommend doing that more than once, maybe twice, 3 times at different places, different departments, so you can see the different aspects of it. You can work with more than one providers, because every provider does have a different point of view and the way they work. So I definitely do recommend more shadowing hours than required. Would you say any?
I would also say while you are working in your ICU, because again, you have to have that experience before even applying, to just take advantage of any experiences that may be going on, like maybe they're doing a bedside intubation or bronchoscopy, even simply, a resident putting in an A-line, to just kind of watch that and gain as much experience as you can, because it'll just help in the long run to be familiar with certain procedures that you may or may not be doing as a anesthetist.
I agree. Maximize that resume.
So I'm gonna kind of shift gears here. I want to know why you all decided to pursue nurse anesthesia program here at Michigan State particularly, or why did you guys decide to even go anesthesia?
Okay. Okay, I'll start off. So I personally, when I started going to college, getting into the nursing degree, I did not know I wanted to be a CRNA. But working in the ICU the first couple of months and doing the critical working, and like Michelle stated, doing the bedside procedures, bronchoscopy, intubation, working with CRNAs every now and then, and the intubation process kind of made me like the critical thinking, and I do definitely enjoy doing that a lot, whether that is working or thinking. I think that was definitely the biggest reason for me, is to kind of optimize what I have and take it to the next level, and just constantly, kind of use your brain a lot.
Yeah, definitely the higher level thinking that is required. For me, it was more the independence of the practice versus maybe bedside nursing. I was in nursing school when I saw a CRNA operate in the ICU, and just how she did what she did and how she commanded the room, and just knew what she was doing, knew which drugs to give, and safely intubate the patient. So I wanted to be able to use what I learned in school and apply that to my practice. I chose MSU because I did the accelerated nursing degree BSN program here at MSU. So I am back. And so I had a good time. I learned a lot. I think it was a great program and helped me in my nursing career. So here I am.
Yeah.
Well, we're happy to have you back. So just to kind of wrap up here, what are some important things that you just want to put out there about nurse anesthesia, or anyone that's looking into it?
Yes. So if you are looking to join Michigan State, which you should, it is a front-loaded program, which means you will have the first year strictly just studying, only doing classwork. In your second year, you will start doing clinical, which the classwork will definitely decrease. This is something definitely captured me to MSU.
Yeah. Other programs, you have your full class load, and you're also in the hospital doing your rotations. So that's kind of a lot. And we also at MSU have a practice simulation lab prior to going to clinical. So we actually learn how to intubate a mannequin, the whole induction sequencing, and other things as well, which is very helpful. So those are some things unique to MSU.
Well, thank you all for joining us today. It was such thoughtful for you guys to come and educate us on nurse anesthesia. It's well needed. So thanks for coming.
Yeah, thank you for having us.
Thank you.
So we hope you guys found that as interesting as we did. If you'd like to learn more about the nurse anesthesia program, head over to the College of Nursing's website. And if you'd like to learn even more than that, this Thursday, the college is hosting an interactive webinar from 2 to 3 p.m. about the nurse anesthesia program. And you can register for that event by going to the College of Nursing's website and clicking on events.
And lastly, anyone at the age of 16 and up is now eligible to receive the COVID vaccine. It's important for everyone to do their part and get their vaccination. It takes all of us together. We can beat this terrible pandemic. Learn more about how to register to get the vaccination by clicking on the link below.
We have just a few weeks left this semester, so we wish everyone the best of luck moving forward. You got this. Thank you everyone for watching. My name is Taylor Myers.
And I'm Terrence Lindsay, and this has been Spartan Pulse. And have a great week, everybody.